You're watching CTOM TV. Knowledge is power.
So about 8 months ago, after having an MRI with a suspicious 7 millimeter lesion,
Okay.
I had a biopsy, which showed a 3+4
Okay.
with a couple areas just on one side of the gland
Yeah.
that had cancer.
Okay. So, okay, 3+3 grade, 25% of core area. So on the left side, and then you go to 3+4 pattern. Okay. Do you have any other health conditions?
No, I have had some microscopic colitis.
Okay.
Yeah, I had it 10 years ago, and then about 4 months ago, I had another episode.
Okay. Okay. So I would say get that prostate out as soon as possible.
Does that look like an aggressive cancer?
It's really hard to say without the genetic testing. I think it's just best to get it out now and then do the testing on it and see, because it could be upgraded to a more aggressive one once they take a better look at it. You know, it's kind of hard. The biopsy cores are very thin and very small, and they're not really a good representation of a tumor. As you can see, you've got one biopsy core that's 3+3 and the other is 3+4. So I would definitely get surgery if I was you.
What about since it's on one side?
Yeah.
What about the targeted focal therapies?
You mean like a targeted like brachytherapy or radiation?
Well, that right now they're saying me to a radiation therapist to discuss that. But I was actually thinking of things like what Dr. Klotz is doing at Sunnymead.
Okay. Yeah. I'm a big fan of getting it taken out because have you had a PSMA PET yet?
No, I haven't.
Okay, well then I would get a PSMA PET first to ensure you have no metastasis.
Yeah.
I think it's very important. And if you really are set on preserving your prostate, I would probably want to take a closer look at it. I'd want to look at the genetics of those cores if possible. But personally, I am not a fan of leaving tumors in. The reason is tumors release something called exosomes. And exosomes are little membrane-bound transportation bodies that contain the genetics and the mutated DNA and RNA and proteins that the tumor needs to metastasize. And these tumors spread these exosomes out throughout the body, and they can seed and set up other sites of metastasis. They can also get taken up by normal cells and convert those normal cells into tumor cells elsewhere in the body. So you want a tumor out, and you want to get as many of those tumor cells out as possible. Radiation therapy may kill 99% of them, and you may be good for a while, but if that 1% is still there, that's going to be a problem.
Right. Well, after that's what the surgeon said. And then I did see a second oncologist who said, let's get you the gallium scan and then we'll talk.
Yeah. Okay.
Well, 6 months later, I was turned down for the gallium scan.
Right.
I went back to that doctor and he just retired. So I never got the benefit. I think you know who I'm talking about now.
Yes.
So I never got the benefit of his advice.
Yeah.
And I got passed on to now a younger oncologist who said, oh, I think brachytherapy is a great way to go. So
is that Dr. Yusuf?
Yes.
Okay. He's really good. Definitely. I haven't worked a lot with him yet, but definitely he's a really smart doctor. And statistically speaking, he's correct. Brachytherapy is definitely really good. But I just don't like the idea of leaving a tumor in. And I'm going to have to agree to disagree with his assessment there.
Okay.
I mean, he's definitely a great oncologist, and he's practical. But when you have that surgical material, then you've got something you can look at further. You can do the analysis, you can do the different tests, and so on. And I think in someone like you that's fairly early stage, I would be very aggressive in your diagnostics right now and your treatment.
Mm-hmm. So I'm hearing a couple of different things. I'm hearing, like, for example, what you're saying. I'm hearing what my GP says, because you have an aggressive cancer, you've got to do something about it. I've also gone to a holistic counselor who then put me in touch with a naturopath specializes in cancer. And he said, Stephen, this is a very slow moving, take your time, maybe 1 or 4 years, you'll need treatment. So
he can't say that off the information he has. There's just no way. You can't make those sort of assumptions. I mean, yeah, it may be slow going. It just may be, but do you really want to take that chance?
Yeah. Now,
I mean, it's like driving to the store without a seatbelt.
Okay. Now, you mentioned about PSA. My PSA had gone up to about 5.5, but
Okay.
But since that time, I've gone to a plant-based diet and taken supplements. Okay. Subsequently, 3 months later, my PSA was 3.5.
Great.
Good. Should I take away anything from that, or does that mean anything?
No, definitely. There's lots of things that can affect PSA. Does it affect the growth of the cancer? It's another issue. PSA is not always just the growth of the cancer. You could see PSA going up and down. Your PSA is fairly low right now. Now's the time to strike. In my opinion, if I was you, I wouldn't wait any longer, and I would get that out as soon as possible and still get a PSMA scan. And even, put it this way, if you have metastasis, they're not going to spend the money on taking it out. So if you get a PSMA scan now and it shows metastasis, they're probably not going to take the prostate out, which is not a good thing, because even if you do have metastasis, you're going to want to have it out. It's a cost-saving thing. Typically, they don't do surgery on metastatic disease in Canada because it's not that beneficial, or cases are not that beneficial, and sometimes it is, sometimes it isn't. It's my job to be the negative naysayer and prepare for the worst case scenario, because that's what I hear every day. I have no shortage of people saying, oh, I was told this and this, and I did this and this and this, and then now it's back. I was told I would never have it back again. I was told I was cured. I get this every day, all day long. So for me, your best option is to get it out and then do the PSMA scan. And then if you do have any metastasis elsewhere, obviously you're going to have to go on something, but at least you don't have the prostate there sending out signals to these metastatic places. I think that's really important.
Okay, thank you.
Do you have concerns with surgery?
Yeah, when I read about it, it doesn't seem very appealing.
Yeah, it really depends on where you go. You want to get surgery at a major center. The larger the center you go to, the less complications you're going to have. And if you go to a teaching hospital like VGH and get the robotic surgery, make sure you tick that little box that they tell you to, or that's in there that says, I only want the professor or the teacher doing the surgery, because I missed that box. And when I went for my surgery, they slashed an artery in my kidney, and I ended up losing part of my kidney for something that was totally avoidable. I just didn't tick that little box because they had me sign the papers just as they're wheeling me into surgery. So you make it very clear, if it's a teaching hospital, and a lot of places are teaching hospitals, you make sure that the teacher is doing the surgery and not the students.
Stephen, is there are other reasons that you might want to hang on to your prostate? Is it the surgery that you're a little concerned about?
Yeah, I guess I haven't really had any surgery. So the idea of losing part of your body, even though it's a small part, that is not appealing.
No.
That the idea that maybe I could do some focal treatment and still preserve some of it seems more appealing.
And that may be the case, but do you want to take that chance? Do you want to risk it when you have an opportunity now to make a huge impact?
Yeah.
I mean, this is your decision, obviously. I think you need to really seriously think about this.
Yeah. It's not easy though. And
Tough
certainly,
decision.
in the medical system, things like surgeries are often tossed about fairly cavalierly.
Mhm.
And I do appreciate what you're saying, Stephen, about just the reluctance to lose a part of your body and just to go through that whole process if you don't need to. And I guess, what we're trying to say here is if you have a chance to get the cancer out, that's the best thing you can do for you.
Mhm.
And then, of course, following up with the proper testing to make sure you know what was happening there. And if there are metastases or if there is a recurrence, and you can hit the ground running with the proper treatment right away.
Exactly. We have a good friend that just recently had prostate surgery, and he elected to get it out. And his disease is done. He's cancer free. He's enjoying life, and he said it was nothing. He said it was easy. He had robotic surgery, and the robotic surgery doesn't take very long. The recovery is really quick with robotic surgery, and he didn't get any negative side effects whatsoever. So they do these surgeries all day long. If you go there, it's like take a number. And he was in and out of the hospital very quickly. I had a complication because I didn't get the doctor who I was hoping I would. I got a student who had probably never done it before. And that was my problem. And just because I didn't sign the form properly. So definitely, it's probably not going to be a problem. Now, if you're in some small town somewhere in the prairies or something, I would say, okay, you may want to go to a big city center like Toronto or Montreal or Vancouver.
Thank you for watching Cetome TV. Subscribe below and stay informed.